Hi guys, welcome back to our channel. My name is Yadira, and for today's video, this is another pregnancy related sit down talk through video. So Jazz and Jose are not going to be in this one, but if you guys do want to see any of our videos, make sure you guys watch our vlogs. We have quite a bit and I think you guys will really enjoy them. For today's video, as you guys can tell by the title, I'm going to be talking about the glucose screening testing, aka the gestational diabetes test that you get while you are pregnant. I hope this is a short video. I do have my notes though because I don't want to miss anything. I had my test done today, so I thought it would be a perfect time to talk about it, kind of like what it is, what to expect, and how it went. I still don't have my results, but I will talk about my results in my next video. So whatever they tell me, I will let you guys know. The reason I decided to make this video is because I was very unaware of this. Since I did have a preterm pregnancy in my last pregnancy, I don't remember doing this. So I wanted to do this video to help you guys and also give you guys a little bit of tips and kind of like let you guys know what to expect, you know, because I feel like there was a lot of lack of communication from their part for my testing done today that I was a little confused on what everything was. By the way, I'm not a doctor, I'm not a nurse, I'm not in the medical field whatsoever. This is just from solely my own research, but this is not medical advice from me. So make sure you guys do your own research, contact your doctor, ask them questions. I'm just trying to spread information that I researched myself and that I asked. So I could be wrong. And if I am wrong, please correct me in the comments down below because we don't want to be putting misinformation out there. I'd rather be corrected than spreading false information, okay? So what is gestational diabetes? Gestational diabetes, also called diabetes during pregnancy, is a form of high blood sugar affecting pregnant women. Those who develop gestational diabetes are at higher risk of developing type 2 diabetes later in life. This test has to be done anywhere from 24 to 28 weeks. I am currently 27 weeks and 2 days. It is a very important test because if you come out positive, which we will talk about the number ranges in a minute, but if you come out positive for this, then there are some complications that can happen, which is why they need to keep a close eye on you and your baby. Some of the complications that can happen if you do have gestational diabetes, and I'm not saying it's going to happen to everybody, are preeclampsia, blood sugar problems for the baby after the baby's born, abnormally large babies, which also means if you have like a really big baby, there's like a lot of complications, like that baby can tear your shit up. And the last thing is stillbirth, and that is extremely scary. I don't even like thinking of that. Also, 5 to 18% of pregnant women develop gestational diabetes. It's not such a high number, but it's pretty common, okay? And here are some things to keep in mind before you get your test done, which again, like I said, they failed to communicate with me. I didn't know that you had to fast. Thankfully, I was still in the time range of fasting, but they didn't tell me like, you know, you have to fast for a certain amount of time. You can't drink, eat, or anything. They didn't say anything like that to me, which kind of sucks because, you know, what if I would have literally like ate yesterday super late and then like I would have to do this all over again, and that wouldn't have been cool because it's very time consuming. So make sure you fasted for at least 8 hours before your test, but no more than 16 hours because you guys know as pregnant women, we need to be able to eat. It might not happen to everybody, but at least for me, anytime I go long periods without eating, I start getting nauseous. And sometimes like with the nausea comes vomiting. So we want to avoid that. So I would try to do at least 8 hours. And for those that don't know what fasting means, it means that you should not be eating or drinking anything. If you do eat or drink anything, it is best to cancel and reschedule your appointment because those numbers can fluctuate. That's the last thing you want to do, is have to repeat this thing twice, especially when it's so time consuming and time sensitive already. Here's another one. Be prepared to be there for anywhere from 1 to 5 hours. Nobody told me that. I was there today from 8 in the morning to 10:50. Basically 3 hours, you guys. You're not supposed to really be leaving the building. They allowed me to go to the car. There was a Dollar Tree right down the street, and I asked them, I was like, can I go to Dollar Tree to buy like a couple of things? And they're like, yeah, sure, you can. So I went to Dollar Tree, but they want you to kind of stay in the area. Also, you're not supposed to be doing like a lot of like physical activities, and you cannot, I repeat, you cannot eat anything, like nothing. No coffee, no tea, no cereal, no banana, nothing. All right, so now let's talk about how they actually test you. They drew my blood to get a baseline. A baseline basically means like this is like your starting number. And then the girl gave me this glucose drink. You know, like the little mini sodas? I want to put a picture of it. It's kind of like that. I know they have different flavors. They didn't offer me any flavor. They just gave me like an orange one. It tasted like the Fanta soda. If you guys know which one that is, that's what it tasted like. Just a little bit sweet. And then she said, you got 5 minutes to drink this, and she put a little timer, and she's like, you have to finish it within the 5-minute period. And I'm like, bet. I pretended it was a little mixed drink, and I chugged that shit. I think I drank it in like 30 seconds or less. I kind of wanted to just get it out of the way. At this point, I already knew how long I was gonna be there. So I was like, yeah, I'm not gonna add 5 minutes more to my time being here. By the time she was like done writing, she looked at me. I handed her the little bottle, and she's like, oh, that was fast. Some women take a really long time to drink it. And I was like, oh, yeah, I just wanna be out of here. And she kind of just giggled a little bit, and she's like, okay, so we're gonna put the timer. You have to be back within an hour. So that's when I went to Dollar Tree, bought a couple things that I wanted to get, and I needed to go to Dollar Tree anyway, so I was like, let me just use my time to do that. She made it very clear though that I couldn't eat anything, and I could only have no more than 8 ounces of water per hour. While you're waiting for your blood to be drawn again, you cannot smoke, which if you are pregnant, you shouldn't be smoking, and you cannot breastfeed, and you cannot pump, and you cannot eat anything, nothing, settle, zip, shut it, nope. But you can have 8 ounces of water every hour. I just took a couple sips just to get that like sweetness off my throat, and that was it. They do tell you if you feel sick or you throw up that you have to let them know as soon as possible or while it's happening, because then she didn't really say anything. She just said, if you start feeling sick or if you throw up, come knocking on the door, we'll get you in the back. And I was like, okay. Thankfully for me, it wasn't an issue. I have read on like other forums where moms have talked about this test and they have thrown up or it made them feel icky. I did feel baby become very, very active, which was kind of cool. I don't know if it was like just that little spike of sugar that she's like, ah, you know. If you feel sick, let them know. Now let's talk about the numbers. Basically, the way this test works is for a normal non-diabetic person, or if you don't have gestational diabetes, your glucose goes up, right, within that hour that they gave it to you, and then it starts coming back down. And that's how they know, like based on the numbers, that's how they know if you have gestational diabetes or if you don't. But for a person that has gestational diabetes or is diabetic already, basically when you give them the glucose, your blood sugar goes up and it kind of refuses to come down, so they know something is wrong because your body is not, I think it's not producing enough insulin. I could be wrong, but I think that's what it is. Anything below 126 means you're good, no gestational diabetes. You can continue your normal diet, drinking, whatever you're doing. Not like day drinking what you normally drink, you know, but no alcohol. So anything above 140 is gestational diabetes. If you do come out positive for gestational diabetes, they will keep a close eye on you. They might modify your diet, which I guess when you're pregnant kind of does suck. I mean, even in general, like when you modify your diet sucks. But just think about it this way. It's just a temporary thing, hopefully. Okay, they might ask you to exercise a little bit. They might give you some medication. Some people take some insulin, and you're gonna have to be checking your levels throughout your pregnancy. How often are you gonna have to do that? I don't know. That's a conversation between you and your doctor or you and your midwife. And it also all depends on how severe your case is. Like I said, there are complications that we mentioned in the beginning: preeclampsia, stillbirth, abnormally large babies, blood sugar problems for your baby. So we got to keep a close eye on that, girlfriend. What to take away from this video: make sure you guys fast, no eating, no drinking anything, and no eating or drinking anything while you are testing besides 8 ounces of water every hour that is allowed. And if you can chug it, make sure you chug it. That way you get it overdone with. Be prepared to be there for a pretty long time, anywhere from an hour to 5 hours. I was there 3 hours. Kind of sucks. I'm hoping everything comes out normal. That way I don't have to repeat this. But like I said, I will update you guys on my test results in my next video, or as soon as I know. Other than that, thank you guys so much for watching. I hope you guys learned a thing or two. If you enjoyed this video, please give it a thumbs up, comment, and subscribe. Turn on your notification bell so you're notified every time we upload videos. You guys, I do have a little playlist of my pregnancy related like talking videos. If you guys do want to watch anything that's specifically only on pregnancy, I will try to leave it at the very end as well. Let me know in the comments down below if you guys had any testing done, or if you guys are waiting for your results, or what your numbers were. Like if you guys ended up with gestational diabetes, what was your experience? Let us know. Like I said, the more we share information, the more we talk with each other, the more we get to learn. Like pregnancy, I don't know why we've made it into like this little bubble when there's like so much information about it everywhere, you know what I mean? So I love you guys, and I'll talk to you guys next time.